So when we take for hyperextension of the elbow, okay, we know this is extension. We want to limit that, so we're going to flex. Okay. Now, what are a couple of things, key things that we want to keep in mind when we start our taping? We're going to start with the anchors. What's going to be important for the placement of our anchors? Go past the muscle belly. We got the biceps tricep muscle belly here, which is going to help us to keep that from sliding down to the elbow. So we want that anchor to go above the muscle belly, between the muscle belly and the shoulder. We've got the muscles of the forearm. So it's going to be important for, did I say what am I doing? Hyperextension or collateral ligament?
Hyperextension.
Hyperextension. Then, but both of them, it's important to do the anchors above the muscle belly, between the shoulder and the muscle belly of the biceps triceps. And now we're going to go past the muscle belly of the muscles in the forearm. So we're going to go between the wrist and the muscle belly. Why does that help us? Because we put that anchor here, when we pull on it, it's going to gather that muscle. Let me use this input, it shows up better on this muscle. We're going to gather that muscle between the anchor and pulling toward the elbow, and it's going to stop that movement for us. Okay? Probably, if we can talk our athlete into it, we're going to do this directly on the skin. Again, we've talked about that when we do the hyperextension, which helps prevent that from traveling. Okay, so in this class we're going to do the under wrap, protect the skin. Put a pad, grease pad, gauze pad in the elbow to prevent cutting, chafing in the elbow. Anchor, you notice we're above the muscle belly. What do I need to ask him to do? Flex, make a muscle. Okay. I'm almost told it 10 minutes. Okay. And flex. Again, because my habit is just always put two anchors down. And just always do that and relax. His arm's probably going to get tired. Okay, you've noticed I've already put his hand on my arm for support. Okay, I'm going to find a way to help support his arm. Now, if I'm going to take for hyperextension, probably going to put him in supination, because this is where I want my anchors to be, my stirrup strips to be, to support that hyperextension taping. So what I'm going to do, I'm going to say, rest your hand against my chest. Okay? That does two things. That gives him some support and allows him to rest. And the other thing it does, it keeps me from having to chase his arm all over the place while I'm trying to tape it. It allows him to anchor his arm down. Anchors. Now at this point I can do one of two things. Okay? I can start from lateral to medial aspect. Medial to lateral aspect. And look, the tape is crossed right at the elbow joint. That's where I want the strength of the tape to be. That's where I want it to overlap. And now to continue this taping, I'm just going to fill in what I call from inside to inside, inside, inside. And you notice when I do that, I can put my fingers through there. I'm not running the tape flush against the skin from anchor to anchor, because then I wouldn't restrict movement. And I'll take one more strip to complete my fill in the middle. What might I do? What have we learned that I might do at this point? Or at this point, we've talked about doing that in the past. Flex. Flex. All right. What might I do when I put those last strips on to hold it down? We've talked about doing in the past. Okay, remember we talked about making these strips a little longer, putting a anchor strip down, and then actually folding it back, just like we do with the elastic wraps to keep it from sliding out. At this point, what I'm going to do one of two things. I'm going to use stretch tape, I'm going to use an elastic wrap, and I'm going to cover this up to kind of hold it in place. Again, I can do that with the stretch tape or with the elastic wrap. Now, straighten your arm. Okay, bend your arm. Okay, now straighten your arm out, and right there the tape hasn't moved, and you see he's not in complete flexion now as he's go ahead and straighten. You see how the tape is moving from up here. That's why we do it to anchor it directly to the skin, to try and keep that from happening. Hyperextension of the elbow. So that's one way that we could do it. So what's the other way that we could do this taping?
Run the first strip straight down.
Do I?
Run the first strip straight down and go across.